I'm Dr. Jason Jones. Thank you for trusting us for your eye surgery. This video is intended to help give you information about how to take care of your eye after your surgery to get the best and smoothest recovery. Following your surgery on that same day, we want you to use your drops quite frequently. So your medicated drops will be used, for instance, on odd hours every 2 hours, and artificial tears will be on the even hours. That will be every 2 hours as well. You can supplement extra artificial tears if you feel you need those at any time. We would like you to wait at least 10 minutes between eye drops to ensure that you don't dilute original medicine that you put on first with any additional medication after. So to instill an eye drop and demonstrate that for you, I'm going to use this sample bottle of artificial tears. First, you do want to wash your hands just to maintain good cleanliness. Uncap the bottle, keep the cap, and tilt your head back. Pull the lower lid away from the eyeball. Steady your hand with the drop against your forehead, and you can more readily find the eye surface. You want to place that drop between the lid that's pulled away from the eye and the eyeball itself. You kind of form a pocket. Using more than one drop at a time really kind of just uses up your medications or artificial tears more quickly. It's not going to provide you anything better or extra. So one drop at a time is adequate. Be careful about not touching the tip of the bottle to your lashes or your eyeball or your skin. That will potentially contaminate the tip, and you should be cautious about that. So following your surgery, you can actually shower and bathe to your normal routine. Just be careful about getting water or soap in your eyes. Close your eyes if you're going under a shower head, and just try to avoid getting something in your eye during those activities. One thing we do want to caution you about is we do not want you to rub your eye. You can touch your eye gently. You can use a tissue to actually wipe away any tears. Notice I'm not actually pushing much on my eye. If you're feeling more that it's the ball of your eye, you really do not want to be putting pressure externally on your lids. That can actually cause disruption of your incision and lead to problems that we both don't want to deal with. Driving after cataract surgery or other eye surgeries where we've given you sedation, we respectfully ask you to not drive a car or vehicle operating any sort of powered tools, for example, as well, for at least 12 hours. This is just precautionary, but it's better to let yourself be taken care of, and we want that safety to be important for you there. Lifting and bending, you can lift things that are relatively light. We'd like to restrict you to no more than 10 pounds for 5 days after each surgery. Just for reference, a gallon of milk or a gallon of water is approximately 8 pounds. So if you want to restrict yourself to that gallon-sized product, that's about the most you should be lifting. Once again, that lifting issue may put strain on your incision, and that could cause difficulty or problems for you in terms of your best recovery. However, you can bend over and pick up light things. You can bend down and tie your shoes, pick up a newspaper, those sorts of things. It's just a matter of actually the lifting issue that we want to avoid. Now, we do want to protect your eye from excess sunlight, especially immediately after surgery, and we're going to give you a very nice fancy set of plastic spectacles as protection. These can fit over any prescription glasses usually. This is going to help protect your eyes from excess light. It's also going to give you sight protection from anything that might be inadvertently blown into your face or your eyes. So it's just a matter of having some extra layers of safety there, especially when you're outdoors. You can use these for at least a week after each surgery. You can use them longer. I do see them occasionally around town. Patients still do wear them, and they do function as a mild sunglass, and they're nice to use. And then lastly, makeup. If you're a person who wears makeup, I would recommend you avoid wearing makeup for at least a week after surgery around your eyes in particular. Once again, it's a matter of actually removing that makeup is a big issue in terms of potentially pressing on your eye. Also, makeup can help to harbor bacteria and other things that we don't want to have around your eye, especially shortly after surgery. Long term, proper makeup use with fresh makeup and a good makeup removal product is entirely appropriate as you may see fit. So, thank you for paying attention to these sorts of little detail things. They do make a difference. On the day of surgery, following your surgery, you will be given a schedule for drops for that day, as well as a separate schedule for drops that will continue over the postoperative time frame for you. Follow the schedule, mark off and check off when you've used your drops to ensure that you stay on track for those. And those are individualized for the type of medication and the surgery that you're having. So refer to your instructions and schedules. So following your surgery, your vision may not be completely clear right away. Initially, after surgery, you are still going to often have dilation of your pupil, and you may have other needs of focusing your vision, such as astigmatism correction or other things that you won't have available immediately after surgery. So don't expect your vision to feel always perfect immediately afterwards, but you should have brighter and generally better vision. As your dilation wears away, your vision should continue to improve for you. If you are having a noticeable decrease of vision, if you're having significant pain to your eye, especially pain that becomes worse over time, and that is not relieved adequately by extra strength Tylenol, you should be calling our office. Other elements that you should call our office for is if you see flashes of light in your vision, dramatic or noticeable increase of floaters, any partial vision, if you have significant nausea or vomiting, you should be calling our office. Our phone number is listed in your paperwork, and we do answer our phone 24 hours a day, 7 days a week. We want to thank you for choosing us for your eye surgery, and we hope you have a speedy and great recovery. Thank you.